Welcome to our presentation on implementing the Equal Access Rule, policies for LGBTQIA2S+, and preventing family separation presentation. My name is Sakina Hoyt. I use she, her pronouns, identify as Black and African American, and I'm an associate director on the Federal Technical Assistance Team within CSH. And I will let my colleague introduce themselves.
Hi there, my name is Allison Nye. I use she, they pronouns. I identify as white, and I'm a senior program manager with CSH.
Thanks, Allison. Before we get started, I want to send a huge thank you to Housing Innovations and Abby Lynn Miller and their work on this presentation on the Equal Access Rule. And just huge thanks for this incredible presentation. So our goals and the objective for our time here together will be to better understand the requirement of HUD's 2012 and 2016 equal access rules. We'll delve into these really critical regulations to ensure that our practices align with federal standards for equal access rules. We want to also understand HUD's prohibition on involuntary family separation. We'll discuss the importance of keeping families together and the specific protections in place to prevent involuntary separation. We want to understand the terms encompassed within the LGBTQIA+2S umbrella. We'll explore the diverse identities and experiences within the LGBTQIA community, fostering a deeper appreciation and respect for each term. We also want to learn about the COC's LGBTQIA2S+ anti-discrimination policies. We'll examine a practical sample agency level anti-discrimination COC policy aimed at preventing discrimination and promoting inclusivity. Finally, we want to understand how to create a safe and inclusive project through good policy and practice. We'll wrap up by discussing best practices and strategies to ensure that our projects are inclusive and supportive for everyone. Let's grow together as we work towards a more inclusive and equitable future. Thank you all for being here and really for your commitment to making a difference. In this section, we'll be level setting and introducing to some and reintroducing to others terms used for self-identity. Many people avoid discussing the topic of gender identity, expression, and sexual orientation as they fear they will say the wrong things. It's important, though, to listen for and respect self-identified terminology. We use the gingerbread man to help illustrate and provide meaning to these terms. So for the head, we equate that to gender identity, the internal perception of one's gender and how they label themselves based on how much they align or don't align with what they understand their options for gender to be. Often, this is conflated with biological sex or sex assigned at birth. The heart we equate to gender attraction, how you feel yourself drawn or not to other people in a sexual or romantic way. Our outward presentation, gender expression, the external display of one's gender through a combination of clothing, grooming, demeanor, social behavior, and other factors. Generally, make sense of one's scales of masculinity and femininity, also referred to as gender presentation. Sex, contrasting between one's sex assigned at birth and one's anatomical sex can be helpful for a lot of people. It helps to better grasp the ideas of sex. Sometimes we're talking about sex assigned at birth, and other times we're talking about the anatomical sex that someone embodies. Please keep in mind that this is all along a spectrum or a continuum and can really change over time. As we continue, it's important to name a few terms folks might not be familiar with And on the screen and on the closing resources slide, you'll find a link to this comprehensive list of terms to review. We'll also be using the term LGBTQIA2S, which means lesbian, gay, bisexual, transgender, questioning, or queer, intersex, asexual, two-spirit, a term used by some indigenous Northern American cultures to describe a person who embodies both masculine and feminine spirits. The plus symbol represents other sexual orientations and gender identities that are not typically covered by the other letters in the acronym. Transgender, a gender description for someone who has transitioned or is transitioning from living as one gender to another, an umbrella term for anyone whose sex assigned at birth and gender identity do not correspond in the expected way. So an example is someone who was assigned male at birth, but someone that does not identify as a man. Transitioning refers to the process of a transgender person changing aspects of themselves. Examples are their appearance, their name, their pronouns, or making physical changes to their body to be more congruent with the gender they know themselves to be, as opposed to the gender they lived as pre-transitioning. And non-binary. This is a term for people who don't fit into the binary of male or female genders. It's important to understand some of the realities faced by trans and queer adults. On screen, you can see some stats from UCLA's study on homelessness among LGBT adults in the US. It compares trans and queer adults with their cisgender peers. Cisgender or cis is referred to a person whose gender identity matches the sex they were assigned at birth. 8% of transgender adults experience homelessness, while only 3% of their cisgender counterparts and genderqueer sexual minorities did. And 17% of sexual minorities have experienced homelessness in their lives, while only 6% of cisgendered counterparts have. So what does this tell us? We know that trans and queer adults and youth too face homelessness more often than their cis counterparts. Almost all LGBTQ people going into shelters have a fear of them because it isn't a matter of if it's dangerous, it's more a question about how dangerous it will be. Alex Abramovich and Jama Shelton from their book, Where Am I Going to Go? In this book, they demonstrate an effort to address LGBTQ youth homelessness in both Canada and the US. It includes an examination of the identity-related structural barriers that the LGBTQ plus youth experiencing homelessness face while accessing services and transitioning out of homelessness, as well as programs, models that successfully address those barriers. Each chapter addresses a specific need and its associated barriers, accompanied by a case study of a successful program that acts as a solution. According to another study published in 2020 by the UCLA Williams Institute, LGBT people and housing affordability, discrimination, and homelessness, LGBT youth and adults face challenges in accessing homeless shelters and services such as harassment and violence. Staff who are not equipped to appropriately serve LGBT people in sex-segregated facilities in which transgender people are housed according to their sex assigned at birth, which leads many transgender people to go unsheltered instead. LGBT people face widespread harassment and discrimination by housing providers who, for example, studies have shown are less likely to respond to rental inquiries from same-sex couples and are more likely to quote male same-sex couples higher rents than comparable different sex couples. And as a community in a continuum of care, we want to provide safe access to emergency housing and permanent housing that honors people, their choices, and gives them dignity, regardless of how they identify. Okay, so what has HUD done to ensure their programs are providing that sense of dignity and honoring people's choices? The Equal Access Rule, or EAR, a series of three separate regulations requiring equal access to HUD housing programs without regard to a person's actual or perceived sexual orientation, their gender identity, or their marital status. These rules were established to prevent discrimination and promote inclusivity in housing, reflecting HUD's mission to create inclusive communities and quality affordable housing for all. In 2012, HUD issued the Equal Access to Housing and HUD programs regardless of sexual orientation or gender identity final rule. This rule requires that a determination of eligibility for housing that is assisted by HUD or subject to a mortgage insured by HUD shall be made without regard to actual or perceived sexual orientation, gender identity, or marital status. In 2016, HUD issued the Equal Access in Accordance with an Individual's Gender Identity in Community Planning and Development Programs, or CPD programs. This rule ensures that all individuals have equal access to the Office of Community Planning and Development's core programs, including shelters and other buildings and facilities in accordance with their gender identity and in a manner that affords equal access to the individual's family. Also, in October of 2016, HUD issued the Equal Access to Housing in HUD's Native American and Native Hawaiian programs, regardless of sexual orientation or gender identity final rule. This rule applies the same equal access provisions to HUD's Native American and Native Hawaiian programs. These programs are also required to make a determination of eligibility for housing that's assisted by HUD or subject to a mortgage insured by HUD in accordance with the eligibility requirements provided for such programs by HUD, which is without regard to actual or perceived sexual orientation, gender identity, or marital status. The Equal Access Rule defines family as follows. Family includes, but is not limited to, the following, regardless of actual or perceived sexual orientation, gender identity, or marital status. These should not at all factor into determining a family. One, a single person who may be an elderly person, a displaced person, a nearly elderly person, or any other single person. A family can also be a group of persons residing together, and such group can include, but is not limited to, a family with or without children. A child who is temporarily away from the home because of placement in foster care is considered a member of the family. An elderly family, again, these are groups. So a near elderly family, a disabled family, a displaced family, and the remaining member of a tenant family. When projects serve any families with children, they must serve all families with children. That's really key. In this next section, we will discuss the various policies that support and uplift HUD's Equal Access Rule. So Section 5106B in the CFR requires CPD recipients, subrecipients, owners, operators, managers, and providers to establish or amend as necessary and administer program admissions, occupancy, and operating policies and procedures, including policies and procedures to protect individuals' privacy and security so that equal access to programs, shelters, other buildings and facilities, benefits, services, and accommodations are provided to individuals in accordance with their gender identity. That rule also requires that such equal access be provided in a manner that affords equal access to the individual's family. Thus, these are examples of policies that should be informed by the Equal Access Rule. Again, these policies aim to promote and protect privacy, health, safety, and security of all individuals. We really want to make sure that these environments are inclusive and that they're promoting these things for all individuals. Some of the policies that we want to make sure are aligned with the Equal Access Rule are eligibility for services, intake and gender identity, confidentiality and privacy, your name and pronoun usage, physical accommodations, harassment, and discrimination, medication, pregnancy and reproductive health, and the dress code. Gender identity, gender expression, sexual orientation, and marital status must not be used to deny any services to any individual or household. This would be a helpful sort of visual to hang up in your facility for staff to see and for clients to see. Clients report their own gender, and staff must document self-reported gender in HMIS and rely on the client's reported gender for the purpose of determining gender-appropriate accommodations. There is no room for questioning when it comes to a client's name and gender. A person's gender does not depend on whether they have had surgery or other medical treatments, or whether they are perceived to pass as the gender which they identify with. Transgender people presenting for intake shall not be turned away or referred to another agency or facility because of their transgender status and the length or extent of their gender transition. This should not be a part of the discussion when determining eligibility at intake. Staff may not inquire into the medical or surgical status of a transgender client's transition outside of what is asked of all clients, including medications, physical and mental health needs that can be addressed by your programs or partner referrals. Staff may not require a person's gender identity to match the gender listed on an ID or other documents. An individual's gender does not have to match what is indicated on their identification, their state ID, for the purposes of determining gender appropriate accommodations or entering gender into HMIS. This is really critical. Here's an example of how HUD has updated universal data elements. The definitions and categories for several data elements such as race, ethnicity, and gender have been updated to reflect more inclusive and accurate terminology. You can take a look at the second image on the right of the screen. And we'll send this out for you all. Staff volunteers and contractors may not ask questions or seek information concerning a person's anatomy or medical history beyond what's necessary to determine program eligibility, or choose to consider a client or potential client to be ineligible for services because their appearance or behavior does not conform to gender stereotypes. In a couple of slides, we'll discuss potential ways to practice asking more appropriate questions. Please also note transgender and gender nonconforming clients who are approved for services shall be provided with the same range of services available to other similarly situated clients. So we want to ensure that everyone is receiving the same level of service at your programs, within your programs. Now we'll switch gears. We'll discuss policies around name and pronoun usage to help deepen our understanding of why this is important. Here are some stats from UCLA. 47% of trans people in states with few policy barriers have corrected their driver's license versus 8% of those in states with the most policy barriers have corrected theirs. These stats are indicative of the barriers that the trans population face in successfully changing their names on identification. Now on to name and pronoun usage policies. Staff shall only refer to clients using the client's given name and pronouns. This is the name that the client gives you at intake and at admission. This is the pronoun that the client gives you at intake and admission. This includes all verbal or written communications with the client, as well as those communications about or in reference to the client with other staff or clients and in reports or other documents relating to the client's case. So staff should be recognizing individuals as they self-identify, the name that they provide in all written communications and in all verbal communications, including their pronouns. Here are some steps that you can take to create a more inclusive environment within your program. Practice. Practice using your own pronouns. This is super helpful. You can practice by introducing yourself and including your pronouns in your introductions. You can practice asking by incorporating your pronouns into your introduction and then asking for the other person's pronouns. For example, hi, my name is Sakina Hoyt. I use she, her pronouns. What pronouns do you use? You may also use the individual's name until you learn their pronouns. This also takes practice. For example, Sakina completed her intake with Jasir yesterday, and Sakina was referred to workforce development for job training. Sakina left for the job training appointment at 8:30 a.m. this morning. That takes some getting used to, but it's important. Note, if someone shares pronouns with you and you use their name instead of their pronouns, you are misgendering. You must use individuals' names and pronouns as they self-identify. It will also be helpful to become acclimated with your state laws. You can learn the process to update a client's name on their vital documents, and you can share that you'll assist with changing their legal name on IDs and birth certificates. This certainly builds trust. How can staff be more responsive? Use last names if calling a new or potential client in a waiting room or at a front desk. Just the last name. I'm looking for Hoyt. Is Hoyt in the room? Don't make clients feel like their presence is a problem to be dealt with. We want to create a safe and inclusive environment. If you make a mistake, simply apologize and move on. Don't dwell on the moment. It will only make someone feel more uncomfortable and others. And ultimately, you just want to practice. Practice with your colleagues, practice at home. It will help, and it goes a long way to create the atmosphere and environment that you need to help folks get what they need. So I'm going to now turn this presentation over to my colleague, Allison Nye.
All right. Thank you so much, Sakina, for walking us through these best practices for eligibility, for services, intake, and gender identity, and how we use names and pronouns. We're going to continue on and discuss confidentiality and privacy. These policies are crucial in ensuring that we respect and protect the privacy of our clients. First, all clients have an inherent right to privacy. This is a fundamental principle that guides our interactions and our policies. And with that right to privacy, that means staff and volunteers are not sharing a client's transgender status, non-binary status, intersex status, or medical history without the client's direct permission. And as a best practice, this applies to every person across the board. We shouldn't be talking about clients with other clients when they are not present or have given formal consent. And this also carries over with other staff and within our own teams as well, right? We shouldn't be openly talking about people if it's not an appropriate situation, like with our staff or case managers who are participating in case conferencing or seeking guidance on how to best support a client or family. We should also play a role in advocating for clients and, when necessary, share their preferred name or pronouns to ensure that we're creating a safe space that honors a person's choice. And that can look like calling staff or volunteers or other clients in and asking them, use this person's correct pronouns, for example. In practice, here are some things we must be doing in our daily work. Maintaining data confidentiality can often look like staff trainings to ensure that people who are collecting data are doing it not only in a trauma-informed way, but in a way that maintains confidentiality. This can include regular review of policies and procedures to ensure that data is collected, entered, and stored properly. Ultimately, it's important to realize that the data collection can be a barrier to authentically engaging people in crisis. being very clear as to why they are being asked these personal questions and how it directly relates to their housing or presenting need can be helpful. It's also important to explain who can access this information. That is pivotal in building trust. Additionally, letting clients know that they can choose not to disclose information that they're not comfortable with. It's also paramount to building trust and creating an equitable encounter between the provider and the client. Lastly, and equally important is consistency amongst the providers within a COC or within an agency. A client should know that no matter who they are first in contact with when seeking services, that they will be affirmed not only in language, but in action as well. Now we're going to move on to physical accommodations and reasonable accommodations. First, we'll focus on physical accommodations. These are modifications or adjustments made to physical spaces like your office, your facility, a housing unit, to ensure that that structure is accessible to all individuals. So often we can think of this as maybe installing a grab bar for an elderly client, but we can also look at it like having a policy that clearly states gender appropriate bathroom and bedroom facilities, as well as changing areas, are available to transgender and gender nonconforming clients. Having a space for a person to use in accordance with their gender identity is critical to continuing to build that safe space. Here's another example, a very low cost example of how you can continue to try to create that safe space. A simple yet effective way to let folks in your office or your agency know that this is a safe space and you're actively practicing HUD's equal access rules is to post a sign. So on the screen, you can see a couple of colorful examples. You can get creative with this, but be sure that you're practicing what you're advertising. Again, we're working with people who we know from studies and data that Sakina just shared with us are scared and hesitant to enter our emergency shelters because of that possible harm that can be done. So these equal access rules really cover a spectrum of critical areas to help build trust with people and create those safer spaces. A reasonable accommodation can be made for an individual, transgender or non-transgender, who has expressed a privacy need. So a reasonable accommodation can be made according to that individual's need. We also have to consider the agency's ability to provide those accommodations. Agencies should explore options and get creative and flexible with solutions when requests for reasonable accommodations are made. I also want to note that when we're talking about shared or congregate housing options and emergency shelters, shelter clients sometimes express discomfort regarding a transgender person sleeping in or using a bathroom facility that is consistent with that person's gender identity. And I really want to emphasize, another client's discomfort is not a reason to deny access to or equal treatment for the transgender person. Staff must work with clients expressing discomfort to foster understanding of gender identity for the purpose of creating that safe environment that respects and values all people. So we are not supporting accommodations for another person's discomfort. Again, we encourage you, lean into that discomfort and try to foster a better foundational understanding for the client who's expressing the discomfort. So here's some reasonable accommodations and what they could look like in practice. Some of these are very low cost and high impact, and others might be higher cost, but could be considerations for new construction or rehabilitation of facilities. So some things like doors on bathroom stalls that can be latched or locked can promote safety and help ease fears of not having a private space, along with separate single-use toilets and showers. Curtains or other devices that can be easily installed into bathrooms or showers when you can't have that single use can help with privacy. Having alternate times to use the bathrooms or showers if requested can be really helpful when you can't create new space. Alternative housing arrangements, such as hotel or motel vouchers, can be used when available. Set aside sleeping, such as rooms or beds that are separate from others, or like a separate sleeping wing, could be helpful. Private bedrooms can be really useful. They can't be reserved solely for transgender individuals, but sometimes there are separate or private units that are on site that can be utilized. Availability of beds that are close to staff can also be really reassuring if someone wants to know that there is help close by if needed. So get creative and get flexible with your implementation. Now we're going to talk a little bit about harassment and discrimination and having a policy that supports action if this happens. And even though we are trying our best to put in action all of these requirements of HUD's equal access rule, harassment can still happen. And it's really critical to have a plan in place if a transgender client experiences harassment. For example, the incident is reported to a staff member as soon as possible, and the staff take immediate action to ensure the safety of the transgender client. As another example, if the harassment is committed by a staff member, the incident of harassment must be reported to the supervisor as soon as possible, and then the supervisor must take immediate action to ensure the safety of the transgender client. All incidents of harassment must be documented in writing, and this is really critical to have that documentation. Lastly, any staff, contractor, or volunteer who refuses to work with a client due to a client's characteristics or demographics, such as sex, transgender status, gender identity, gender expression, sexual orientation, marital status, or civil union status, must result in disciplinary action. Here's a good example from a community in LA. As a part of their intake and welcoming process, they review an anti-discrimination policy with all clients. And this is in efforts to promote respect for LGBTQIA Spirit Plus individuals. So let's take a moment and I'll read this out loud. And this project welcomes individuals who are heterosexual, bisexual, gay, lesbian, transgender, queer, and or gender nonconforming, of different races, classes, religions, ages, and backgrounds. I will be respectful of the other program participants and staff. I understand that any oppressive or abusive language or actions is not acceptable. And if I have questions about this policy, I can ask a staff member to explain it to me. If a program participant or staff member is acting in an abusive or oppressive way towards me, I know I can report this behavior to a staff member. So again, in this example, it's for all clients. It's not singled out on certain clients, it's for everyone. There's a clear statement of inclusivity that is the practice or policy of providing equal access and opportunities to all people. And there's a clear statement that this type of oppressive or abusive behavior is not welcome in this space. And then there's also a clear path to report the harassment if it does happen. So really critical things to think about when you're creating or reviewing, evaluating your harassment and discrimination policy. Next, we're going to talk a little bit about medication. So medications must be labeled with the client's legal name as recorded in HMIS. However, clients can relabel their medications with their chosen name, and the facility must provide a way for clients to do that. This can be as simple as providing a blank sticker. Medications must always be accessible to the client, and clients have the right to keep their oral medication on them. Clients must have access to refrigeration if it's required for their medication. And we know that some of our clients might be using hormone medications, and staff must allow clients to keep those oral hormone medications with them if they request to do so. Lastly, if required, medical syringes must be stored in an office, and clients must have access to a private and sanitary space to administer that medication and have access to a sharp disposal container on site. Now we're going to talk about your pregnancy and reproductive health policy. It's important to note that staff and volunteers and contractors alike must refrain from making any assumptions about their patients' contraceptives plans, their sexual orientation, or their gender identity and expression. Staff must offer all clients access to the same reproductive health information and services, regardless of the client's appearance or gender, and they must not make assumptions about a client's reproductive status or functions based on their appearance, behavior, or any other trait. Again, with confidentiality and privacy, any information on reproductive status that's shared must come only from the client, and it must not be shared with others. Our last policy to review is around dress code. And so there really shouldn't be any additional dress code restrictions that are placed on transgender clients outside of what is asked of all clients. In cases where there is a dress code and it's deemed necessary by an agency, it should be gender neutral. And if there are gendered dress codes, transgender clients should select the dress code that aligns with their gender identity. And for our gender nonconforming clients, we must allow them to choose a dress code which they feel most comfortable with. So here it's really about letting the client choose and then honoring that choice. Okay, so we've reviewed all of the following anti-discrimination policies with a focus on LGBTQIA, Two-Spirit Plus, and family separation under HUD's equal access rule. Now I'm going to turn it back over to Sakina to talk through some next steps and resources. Over to you.
Thank you so much, Allison. So a couple of next steps and resources. Just very quickly, where do programs have the most room for improvement? Really conduct an assessment of your program as it relates to this rule. Develop more responsive policies, employee standards and guidelines, how to engage and treat clients from assessment, intake through post-admission. That's what you want to look at. Provide training opportunities to your staff continually, your volunteers, your subcontractors, because you want to increase the level of comfort among your staff with serving all populations, including the queer and trans population. Make sure your program's physical spaces are inviting and also responsive. There are assessment tools that you can use to make sure that you're meeting the standards outlined in the equal access rule. If a complaint must be filed, you may do so at the federal level on the HUD website. The link is on the slide. If you believe your rights may have been violated, we encourage you to report housing discrimination because there are time limits on when an allegation can be filed with HUD after an alleged violation. You should report housing discrimination as soon as possible. The KCRHA team will send out local information on where to file equal access complaints in King County. Lastly, please be sure to educate yourself and your colleagues about responding to transgender needs, how we do that in practice. Educate yourself on LGBT plus competent medical care, mental health services available in your area, or if none exist, available telehealth services, as well as support groups, affinity groups, and any other opportunities for community connection for this population. Lastly, there are a couple of resources that we've included here on this slide. What is the Equal Access Assessment Tool? You can see it here highlighted in yellow, but in short, it provides specific action steps for HUD recipients to meet the requirements of the equal access rules in shelters and other facility settings. It helps assess their compliance with regulations and best practices. This is great as you continue to monitor your programs to ensure that you are meeting the standards in the equal access rule and creating an inclusive environment for all. Who should use the tool? This is for agencies, internal use. This tool is really intended for administrative staff. However, your frontline staff can also benefit from reviewing the tool and assisting in the assessment process. There is going to be a webinar for emergency shelter staff, leadership and program managers. Other practitioners interested in learning more about the equal access rule are also welcome to attend. This could include anyone supporting any programs administered through HUD's Office of Community Planning and Development, including the Continuum of Care, homeless assistance, emergency solutions grants program, and the housing opportunities for persons with AIDS program. This training will be taking place on September 12th. So we just want to thank you all for your participation today. Thank you for staying engaged, and we hope that this was helpful and that you'll take the tools and resources that we provided here to help make a more inclusive environment, safe environment for all within your programs. Thank you all so much.